Dear viewers, today we will be talking about analgesics and nephropathy. You are quite familiar that analgesics are uh, drugs that are going to manage the pain. But beside pain management, through the inhibition of certain prostaglandins that are mediators for the pain and paraxia, there are certain friendly prostaglandins that are responsible for 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 maintenance of normal body function. You see, so renal at the level of kidneys, it's going to produce vasodilation. At the level of uh, stomach, it's going to produce the uh, mucus secretion, and these mucus secretion are going to protect our body from the hydrochloric acid. So there are friendly prostaglandins and there are non-friendly prostaglandins. And what important is that analgesics, analgesics, analgesics uh, inhibits the non-friendly prostaglandin PGs, the non-friendlies, whereas there are analgesics that also inhibits the friendly prostaglandins, the friendly PGs, and these friendly PGs are important, as I said, in the management of the mucus layer at the level of what you can say stomach. So what is important? These goblet cells that secretes the mucus and make a protective layer here. But if we block uh, uh, this pathway and this pathway, like drugs through aspirin, so what happens? Then neither these will be synthesized nor this will. So this leads to pain management. But what happened? This is associated with the decreased mucus secretion. So it's going to aggravate the situation of peptic ulcer, or patient having a pre-history of peptic ulcer can 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 suffer problems. But what happened at the level of kidneys? You see, there is juxtaglomerular complex and Bowman capsules, and at this particular level, this is proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule, and you can see in the collecting duct. So in this collecting duct level, so it goes into the ureter. So what is important? This is the afferent arteriole, and then it is the efferent arteriole. What is important is G4. So the PGs uh, important for us. There are certain PGs which are important for maintenance of this vasodilation here, vasodilations, and this vasodilation, you see, will be helpful. So if there is no PGs here, friendly PGs are blocked, so this will lead to ischemia, and renal ischemia will be associated with the problems at the level of what you can say damages to the level of vasa recta. So this is cortex region. This is the cortex region in the kidney, and then it is the medulla. You are quite familiar with this, and 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 it is the cortex region that's have juxtaglomerular complex of the working most optimal working where the G4 is going on, you see, and then it goes down to the, and so vasa recta is here, and it goes here. So the medulla region is at the inside. Now what is important, if this particular region is damaged, this is damaged, then it is important to understand if this particular region is damaged, So damaging the vasa rectal damage is associated with or followed with what you can say interstitial fibrosis. This is associated with interstitial fibrosis, and this interstitial fibrosis will 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 also be associated with the tubular atrophy as well. So tubular atrophy will be atrophy as well. So thus, in nutshell, what are the possible damages with the with the with the with the with the analgesics? So there is papillary capillary capillary necrosis. Capillary necrosis. The second one, which is very prominent, is the interstitial fibrosis. Interstitial fibrosis. And the third one is, which is very important, consequently, is the tubular atrophy. So a question may be set in the paper and list uh, the key um, characteristics or the damages that will be produced by the analgesics at the level of kidneys or analgesic nephropathy. What important is that the RFTs usually we advise or the clinician advise RFTs, the changes are prominent only then once there are changes, what you can say, in this particular parenchymatous tissues in the tissues are very prominent. So RFTs changes when the changes are prominent. Thus, never wait for the RFTs. Go do ultrasonography from a very good ultrasonologist. Ultrasonography from a very good sonologist. This is advised. And the second advice is that that if required, you can take other radiographic techniques, including radioisotopes, but that will be through radioisotopes investigation or diagnosis. You see, investigation or diagnosis, but this will be through a very expert urologist or nephrologist. I hope that you understand. Thank you.